An Army surgeon's kit contained the few tools needed to treat wounded soldiers. Knives and saws of various sizes for amputations, forceps to keep a wound open and extract bits of shrapnel, catheters to draw off blood from the wound, various bandages and tourniquets, and anesthesia, if available. Gunshot wound of the head. Surviving a bullet wound to the head, neck, or face during the Civil War was unusual, as all wounds became infected in those days. Even the slightest head or scalp wound could prove fatal. Bone excision. One of the most functionally mutilating operations performed during the Civil War was bone excision. Rather than amputate a limb that had suffered a bony fracture from a gunshot, part or all of the bone was removed, leaving the patient with a useless dangling appendage. Amputation at the hip joint. The most serious operation attempted during the Civil War era was the amputation of a leg at the hip. It involved the disarticulation of the largest bone in the body from the largest joint. Blood loss, shock, and infection claimed most patients' lives. Amputation. Amputation was the most common surgery performed during the Civil War. 3 out of 4 operations were amputations. Usually when a soldier was struck in an appendage by a minie-ball, if it hit the bone would splinter. It would usually carry skin and dirt into the wound. The surgeon's only option was usually amputation. The survival rate for amputations done in the first 24 hours after an injury was very good, with only 25% mortality. When amputations were done after the first 24 hours, the mortality rate doubled to 50%. Naturally, surgeons tried to ship patients through as quickly as possible. The surgeon usually had an operating table of a couple of boards between barrels. He usually had a rag soaked with chloroform, which was liberally doused. Today it is recognized as a dangerous procedure. Somehow surgeons knew enough to periodically remove the rag or sponge. Therefore, few deaths resulted from chloroform poisoning. It is generally a myth that most operations were performed without anesthesia, with only a bullet to bite. Surgeons usually used the following procedures. First, the surgeon would cut off the blood flow with a tourniquet. After that, he would take a scalpel and slice through the outlying tissue and flesh. Then he would use a hacksaw-like tool called a capital saw to saw through the bone. It had replaceable blades. After the bone and flesh was all sliced off, the surgeon would take silk sutures in the north and cotton sutures in the south and sew the major arteries and veins together. The limb would be dropped on a pile that got thrown out after the end of the day. Time was of the essence, so the soldier would be carried off the platform and another soldier would be placed on the platform. This would take about 15 minutes. When the minie-balls that were common during the war hit someone, bacteria was usually carried into the wound, making it worse. After an operation, they thought it good if pus formed. They called it laudable pus, when really the pus was a sign of massive bacterial infection that would usually kill the soldier. Amputation saved more lives than it killed. It was remarkably effective considering the medical knowledge of the time. Doctors only attended 3 semesters of 13 weeks of medical school. Medical schools were all over during the Civil War period. Most of these were just diploma factories, providing very little real training. As there were no medical licensing board at the time, these diploma factories were tolerated. At the beginning of the Civil War, the U.S. Army had a medical corps consisting of all of only 98 surgeons and assistant surgeons. No one called physicians doctors in those days. They were all called surgeons. No surgeon used hypodermic syringes to administer medicine. Instead, morphine, the leading pain-killing drug of the time, was rubbed or dusted into the wound. Sometimes it was also given in the form of opium pills. They had no idea what addiction was, and so many soldiers came home from the war addicted to opium. Fortunately, these poor soldiers, opium was available at every self-respecting local druggist. Asepsis in the Civil War. Under battle conditions, aseptic procedures went by the board. Wrote one doctor, "We operated in old blood-stained and often pus-stained coats with undisinfected hands. We used undisinfected instruments and marine sponges, which had been used in prior pus cases and only washed in tap water. Surgeons probed chest and abdominal wounds with their fingers, so it is not surprising to learn that among Union soldiers, the average mortality in cases of the abdominal wounds was 87%. Families wanted their dead relative's body brought back from the war. There was a whole new profession built around embalming during the war. Families could hire an embalming surgeon to embalm the body of the dead soldier and bring it back for burial.